Thank you very much, Mr. Speaker. I've been going over the terms of reference for the Health Quality Council's review, and you know, maybe it's just because I can't get last week's charge that the Council has engaged in junk science out of my mind, but I'm finding discrepancies. For instance, there's a promise to look into the possibility that the safety and quality of care of 250 cancer patients was seriously compromised by a delay in surgery, quoting here, as alleged in a document tabled in the Alberta Legislature on February 28, 2011, end quote. Mr. Speaker, Assembly documents and records show no such tabling. To the Premier, of reference refer to a non-existent document. How can a skeptical public trust the Premier?
Not quite sure what the honourable member is driving at, but as I said before, the Health Quality Council will listen to anyone who comes forward with evidence in terms of ideas and maybe give some history in terms of how we did operate in the past, how we can improve in the future in terms of new funding, getting better value for the dollars. All of that is on the table.
Thank you, Mr. Speaker. Again to the Premier. Given that the Council's terms of reference limit the review to the years 2003 to 2006, when the period in question begins with Dr. McNamee's patients in 1999, how is the Health Quality Council going to adequately investigate these allegations in any depth?
The Honourable Minister.
Mr. Speaker, the items referred to were those that have been tabled in this Assembly, and the tablings covered two essential areas. One of them was the impact of wait times on emergency care, and the other, which I think was a single document, was wait times with respect to cancer care. So, based on what was tabled, that's part of what I assume governed the terms of reference that were developed independently by the HQCA.
The Honourable Member.
Well, Mr. Speaker, those documents certainly weren't tabled on the 28th of February 2011. Again to the Premier, given that the Health Quality Council is unable to even determine where it needs to look, will the Premier commission an independent, fully independent, judge-led inquiry into these allegations?
The Honourable Premier.
Mr. Speaker, as I said before, the Health Quality Council is very rigorous and robust terms of reference, and they can go back as far as they want. They can listen to any evidence that they want. They can call anybody to deliver the evidence. And as I said, some of these issues go back 15 years. Come forward. You got some issue 5 days ago, come forward. They're there to listen.
The Honourable Member for Edmund Calder, followed by